Hi, my name is Amanda Kearney, and I'm in the Psychiatric Mental Health Nurse Practitioner program. My PICO question was, in adults with schizophrenia, how does self-medicating with nicotine compared to prescribed antipsychotics affect negative symptoms of schizophrenia within 1 year? This problem is important because schizophrenia is a severe brain disorder in which people interpret reality abnormally, leading to hallucinations, delusions, and disordered thinking. Antipsychotic medications have been the standard treatment, but due to side effects and stigma regarding mental health, patients may be reluctant to take them. Adults suffering from schizophrenia have turned to other means to control negative symptoms of their disease, such as nicotine. The rate of smoking is estimated to be 2 to 4 times the rate seen in the general population, and schizophrenics have a more difficult time quitting nicotine than those with other mental illnesses. This proposes a problem for treatment providers trying to manage the symptoms of this disease and provide nicotine cessation programs. The perception that schizophrenics smoke to achieve better cognitive functioning may explain hesitation to treat tobacco dependence aggressively. 4 studies were reviewed. In Segara's study, Cognitive Performance in Smoking in First Episode Psychosis, the Self-Medicating Hypothesis, 2011, the self-medication hypothesis explains the high levels of cigarette smoking in schizophrenia, and the patients may smoke in an attempt to reduce their cognitive deficits and symptoms. Conducted on 89 patients, both non-smoking and current smokers, which were not allowed nicotine. Neuropsychological assessments were performed at bedside. These were performed at baseline, month 6, and month 12, found that the non-smoking patients showed significant cognitive improvements and the smoker's symptoms worsened after the first year. Zhang's study, Sociodemographic and Clinical Characteristics of Heavy and Non-Heavy Smokers Among Schizophrenia Patients in the Han Chinese Population, 2014, he researched the differences in symptoms between heavy and non-heavy smokers with schizophrenia in the Chinese population. Measurements were taken by positive and negative symptom scales. Zhang found that heavy smokers had a more paranoid type of schizophrenia and scored better on the cognitive performance test than the non-heavy smokers. In Drush's study, Effects of Nicotine on Social Cognition, Social Competence, and Self-Reported Stress in Schizophrenia Patients and Healthy Controls, 2013, the self-medicating theory regarding cognitive performance was researched on 53 smokers, both schizophrenic and not, either given a nicotine patch or placebo patch. The findings were that patients receiving the nicotine replacement had higher cognitive functionings than those receiving the placebo. In Sehe's study, The Effect of Dopamine Partial Agonists on the Nicotine Dependency in Patients with Schizophrenia, 2010, 139 smoking schizophrenics receiving antipsychotics in outpatient treatment. Measurements were taken by the Fagerstrom Tolerance Questionnaire and Assessment of Negative Symptoms. Those receiving an atypical antipsychotic had lower nicotine cravings and dependence, and those receiving a typical antipsychotic had a higher nicotine dependence but higher cognitive functioning. Acknowledging the importance of self-medication by patients with schizophrenia is key to psychiatric and mental health nurse practitioners. Treating both psychiatric crisis and nicotine dependence at once can be overwhelming for the patient and cause patients to act out or isolate and withdraw. Nicotine withdrawal and unaddressed cravings can lead to severe agitation and anxiety in an already situational crisis for inpatients, causing mental health providers to hesitate in smoking cessation programs. An intervention that could be implemented in a standard protocol for nicotine replacement in an inpatient setting. Nicotine could be replaced with an adequately dosed transdermal patch until a mental health crisis was stabilized. Then a smoking titration or cessation program could be initiated, such as a tapering amount of nicotine received dermally by a patch until patient is eventually nicotine-free. Once patient is through the psychotic crisis, education and cessation programs can be completed when a less restrictive level of care is required, such as an outpatient setting. When stabilized, a schizophrenic patient should be able to verbalize the understanding of the education and the dangers of the nicotine. Thank you.